Hi! If you're finding this video, you're either pregnant or thinking about becoming pregnant or just wanting to learn about pregnancy, so welcome. My name's Krista. I'm a pelvic physiotherapist and I have expertise in pregnancy and postpartum care. Your body changes quite a bit during pregnancy, and it's quite incredible because it's such a natural process. Your body knows what to do and changes and adapts throughout pregnancy. There are a few major systems that I know about as a physiotherapist that I can teach you about that will change and modify as you move through pregnancy. The first system is your abdominal muscles. As baby or babies grow inside you, your abdominal muscles need to stretch to create space for this. These muscles are incredibly good at stretching, and they should be pretty good and strong in order to support your core. If these muscles have any difficulty as they move through the stretching process, you might notice things like coning or doming in your belly. It looks sort of like a little tent of your skin. You might notice that your back is sore, your hips are sore, your pelvis is sore, your abs just feel really weak. The great news is that a pelvic physiotherapist can help you learn how to optimize your core function even right now, even at the start of pregnancy or even before you get pregnant. And so reaching out to a pelvic physiotherapist with pregnancy and postpartum training can be really supportive for your abdominals. Next thing that needs to change and modify as you move through pregnancy is your pelvic floor muscles. So your pelvic floor muscles are these muscles that are in the bottom of your pelvis here. They fill the whole of your pelvis. Those muscles are incredibly important for supporting your body weight, stabilizing your core, and supporting your pelvic organs, including your uterus. So as things change throughout pregnancy, the demands that the pelvic floor muscles need to be able to do change. And so generally they have to work a little bit harder, especially as your baby increases in size. So generally we want those muscles to be able to be strong enough to support everything really well, but also be excellent at relaxing so that when you're not on your feet, when you're not doing stuff, your muscles can fully relax because they're probably going to be a little bit more tired than what you're used to. And then when you need them, they'll have all the strength and energy they need to do what you want them to do. The best way for you to, again, support those pelvic floor muscles and support them throughout the changes is to work with a pelvic physiotherapist who can assess and tell you how you can use those muscles. Sometimes what could happen is you might notice that those muscles aren't adapting as well as they could, and you notice things like bladder leakage, bowel leakage, pain with intercourse, or changes in sexual function. All of those things a pelvic physiotherapist can help you with. If you do experience that, don't worry, it is really common. But ideally, you shouldn't need to deal with any of those symptoms. So a lot of folks don't know that you can actually see a physiotherapist who can treat you, and then you don't need to continue dealing with those symptoms. The other change that happens is more from the hormonal side of things. So from a physiotherapy perspective, I have expertise in the musculoskeletal system. So that's muscles, bones, joints, ligaments of your body. And as your hormones change, your musculoskeletal system also adapts. So throughout pregnancy, we know that you're generally a little bit more susceptible to musculoskeletal injuries. So aches and pains in your joints, spraining your wrist, those sorts of things. So being aware of that is important. I think that knowing if you do something that you're used to doing, it could potentially be aggravating or a bit irritating to that joint when normally it wouldn't have been. And that's okay. You can just modify your activity level. Maybe you can't do it for 3 hours. You can only do it for 1 hour. It's different for everyone, but it's good to know that you are a little bit more susceptible. That's not to say that you shouldn't do anything. Exercise is really important during pregnancy. However, if you are noticing that something is aggravating or bothering you, you can think, oh, right, I am a little bit more susceptible to this during pregnancy. Maybe I just need to adapt how I'm doing it or do it for less time or make it a bit easier for myself. The other thing that changes in your musculoskeletal system is as you near the end of pregnancy, a hormone called relaxin gets released. And what that does is it actually relaxes the ligaments that hold bones together. And this allows your pelvis to be able to actually open up for labor and delivery. If you have a vaginal delivery, it's opening up those joints so there is more space for baby to pass through this opening here. Of course, that sounds like it's an incredibly important process, and it absolutely is. Something to be mindful of, though, is that as relaxin relaxes the ligaments of the area, your muscles in the area need to actually do a little bit more, work a little bit harder to provide you the stability you need when moving around, walking, exercising, standing, whatever you might be doing. And so just knowing that this change is happening and that your muscles are going to need to work a bit harder, especially at the end of pregnancy, usually means that changing or modifying how you use your body throughout the day feels most natural to you. So going for an hour walk might have felt fine before, and now maybe your body is telling you, 20 or 30 minutes is all I want to do now. That's completely to be expected, and modifying your activity levels, it's incredibly common throughout pregnancy, and a pelvic physiotherapist can help you understand how you can modify your activity levels so that you still feel like you can be active and give your muscles a break when they need them. There are many other changes that occur throughout pregnancy. I just spoke about the physiotherapy specific changes, but of course there are other changes going on that a primary care provider like a doctor or a midwife can teach you about. If you want support with any of these changes that your body is going through throughout pregnancy, a pelvic physiotherapist trained in pregnancy and postpartum is a great person to have on your team. We actually know that if you have a pelvic physiotherapist involved throughout your pregnancy, generally your pregnancy is a little bit easier for you, and oftentimes it helps prep you for labor and delivery better as well. So if you want to book with one of us, you can visit the link in the description of this video. We see everyone online. All right. Have a great rest of your day.